Welcome everyone to our webinar today. We are pleased to partner with the National Association of Welfare Research Statistics, the Public Consulting Group, and the Administration for Children and Families on this two-part series on the Family First Prevention Services Act from introduction to implementation. APHSA and PCG are sponsoring this webinar as part of NARS's virtual learning series. My name is Meg Dykert, Policy Associate for our Child Welfare and Family Wellbeing portfolio here at APHSA. And I'm going to start us off with a brief overview of the American Public Human Services Association. APHSA is a bipartisan nonprofit membership organization. We represent state and local health and human services agencies through their top-level leadership, as well as various programmatic staff such as child welfare directors, CIOs, TANF, SNAP directors, and child care through our Infinity groups. APHSA advances the well-being of all people by influencing modern approaches to sound policy, by building the capacity for public agencies to enable healthy families and communities, and by connecting leaders to accelerate learning and generate practical solutions together. Now I'm going to hand it off to Lauren Anatello to start us off today.
Thank you, Meg. Good afternoon or good morning, everyone, depending on where you are. This is Lauren Antello, Associate Director for Strategic Initiatives from the Administration for Children and Families Office of Regional Operations. And I'm also really pleased to welcome you to our third session, a two-part session of the 2020 NARS virtual series. NARS, the National Association for Welfare Research and Statistics, holds in-person conferences every other year where human services researchers, practitioners, and policymakers can come together to talk about their work and how it can inform policy and practice. Several years ago, we began holding virtual events in the years when the conference wasn't occurring. And these events represent an opportunity to keep the NARS community engaged and to highlight interesting research and trends relevant to our membership. Before we get started, I did want to just plug a couple of our upcoming events that will be happening in this virtual series later this summer. Our next event in August, with a date to be determined, will be a panel on how the COVID pandemic has impacted the SNAP program, and we'll be talking directly with state leaders there. We'll also have a session on machine learning and human services, and finally wrap out the series with a cross-system collaboration to serve justice-involved clients. So please keep an eye out on the NARS Twitter feed at NARS Workshop and on our website, nars.org, for more information. As Trevor said, we'll be recording this webinar and post it to our website as well as APHSA in the days to come. Now, before I turn it over to our moderators, I really do need to express my appreciation to all of the folks that made this panel possible. We couldn't have done this without APHSA and PCG, the sponsors of our session, and in particular NARS board members Ann Flagg of APHSA and Tony Ong at PCG, who've been integral in supporting the series. I also want to acknowledge my fellow committee members, Ben Jacques Leslie of Minnesota and Kato Kawabata of Riverside County, California, Asaf Glosser, my co-chair on the virtual workshop committee at MEF Associates, and his colleagues Jordan Engel and Liza Rodler, who've helped with us in promoting the event. Everyone was really instrumental in making this come together. So I'm really looking forward to the conversation, and will now turn it over to our moderators, Dory Sneddon and Chris Fortunato of ACF.
Thanks, Lauren. Dory and I are excited to be moderating this session. During part one of these two-part sessions, the Family First Prevention Services Act requirements was explained. We provided a high-level overview of the Family First legislation with an emphasis on the Title IV Prevention Services Program, and described the standards and procedures that the Prevention Services Clearinghouse uses to carry out the systematic evidence review. In today's Part 2 session, we will learn about how states have approached the requirements for kinship navigation and prevention plans. I'll now turn it over to Dory to introduce our esteemed speakers.
Thanks, Chris. The Family First Prevention and Services Act presents an opportunity for states to reshape child welfare practice and to build evidence related to prevention services for families and children in child welfare. We have a wonderful group of speakers to discuss how states are developing and implementing their prevention plans on the ground. I will give a very brief intro for each of the speakers to allow more time for presentations.
As Trevor mentioned, we also have full bios for each of the presenters available on a handout attached to this webinar. Our first speaker is Dr. Leanne Heaton. She is a senior researcher at Chapin Hall, University of Chicago. She will discuss her experience moving to the application of FIPSA with states and jurisdictions. Our second speaker, Letitia Young, is an in-home program manager for Arkansas Division of Children and Family Services and leads the work on Family First. She will discuss the evaluation and CQI work as part of Arkansas's Title IV Prevention Services Plan and lessons learned. Finally, Veronica Burrows and Dr. Sarah Kay will discuss the Ohio Kinship and Adoption Navigator evaluation. Veronica is a project manager for the Kinship and Adoption Program in Ohio. Dr. Sarah Kay is the founder of Kay Implementation and Adoption Program. Dr. Sarah Kay is the founder of Kay Implementation and Evaluation LLC, a woman-owned small business that provides research and evaluation services to child, youth, and family-serving organizations. She serves as the principal investigator for the Ohio Kinship and Adoption Navigator evaluation. I want to make one point before we start. We'll have a time at the end for a question and answer, so we'd ask that you enter your questions in the chat box at the end of each presentation so that the presenter can see those maybe a little bit ahead of time, and then we will address those questions at the end of the webinar. So with that, I'd like to begin with a poll just to see where all the participants are calling in from today and what type of organization you are with. So I'm going to move it over to this next slide, and you'll see our polling question. If you can please fill that in. I see people are doing that now, and we can get a sense of the types of organizations that you all are with. Okay, wonderful. It looks like we have a really good percentage, a little over 40% from state governments, followed by community-based organizations. That's really wonderful. So with that, I will now turn it over to Dr. Leanne Heaton.
Thank you, Dory, and good afternoon or good morning, wherever you are. My name is Leanne Heaton, and I'm a senior researcher at Chapin Hall. And so today, what we're going to do is we're going to talk about some specific approaches that states have used in their Family First planning, with a specific emphasis on the implications. So I'm going to talk you through some applied examples that we've been a part of in our work across 4 different states. I want to start, though, with the context of EBP exploration. So if you were a part of the first session, you heard a lot about the specific requirements for building evidence. And as you can see here, there are a series of sequential steps that must be met to meet the Federal Prevention Clearinghouse criteria for evidence. So that's true for both parts. But what you can see based on this particular graphic is on the right-hand side, the Kinship Navigation Service is still very much in the developmental stage and doesn't have quite the same level of evidence that we have on the other side, on the prevention side. You're going to hear a little bit later today in this presentation about the efforts to build that evidence base. But since the prevention side has several EBPs that already meet the requirements, and we see that several are more likely to be approved in the future, most of the presentation I'm going to talk about the rest of this time is related to the state's applied efforts at building their 5-year prevention plan and how the EBPs fit into that. So states are taking an opportunity as they build their 5-year prevention plan to use a data-driven approach. And that's what this graphic shows and illustrates. So all the way from identifying the candidates or the children and youth that are at risk for foster care, that they can then align with the right EBP to remain safely at home. And you can see that sequence here in the graphic, starting with identifying target populations, aligning it with the needs that they have that the EBP can potentially meet so that it does allow that child or youth to remain in the home. Okay, so this particular endeavor, building this 5-year prevention plan, even though it is led by the Child Welfare Agency, there's quite a bit of cross-jurisdictional and collaborative governance structure that is needed in order for this to work well. And so this is a graphic and an illustration of how cross-jurisdictional partners are brought into the decision-making and the implementation phases of this. And you can also see at the bottom that the states that we've worked with will build specific work groups that essentially make recommendations for specific parts of the plan. So this is an illustration of one of the states that we work with in their governance structure. So I just wanted to explain a little bit more as the work groups come together. This graphic illustrates how they work on specific parts of their plan and how each of those decisions inform one another. Essentially, the work that is developed throughout the planning process is coordinated and connected. So we want the left hand to know what the right hand is doing and also have real-time handoff. Okay, so we've talked a little bit now about specific EBP requirements for evidence. We've just discussed the decision-making and teaming structure. So I want to talk now a little bit about the systematic way that states do this. So when we work with the state, we often invite them to kind of think about this sequentially. First, who are your candidates? Who is going to be most at risk for foster care? Who potentially could benefit? We then go through stages to help them identify their target population. So for example, what we want to know is overall counts. That's very important. The demographics of those target populations, the needs that they may have, and then ultimately where they are located throughout the state. At the same time, there is a parallel effort to do a thorough assessment of the current services throughout a state. And that becomes important because states need to know, like, what do they have already that might work? What is needed? What is the capacity? And what is some of the willingness of the providers throughout the state to provide these kinds of EBPs for their candidates? And this ultimately leads to decision points where you have to align services, you have to think about capacity, you have to think about the rigor and the evaluation components of the plan, and then obviously the fiscal implications. So what I'm going to do next is walk you through specific applied examples that states have used to kind of illustrate this systematic methodology. Starting with what we do with them from the beginning is we talk about, let's conceptualize candidacy. So we use this concentric circle diagram to help walk them through. Who do you think could be at imminent risk of entering foster care in your system? Once they've thought about that, we ask them to move into Circle B, where they determined who is at imminent risk and also the pregnant and parenting youth that are part of the candidacy work. From there, we ask them to think about the needs. What kind of needs do you think these particular candidates have that could be assuaged, or an EBP might help reduce that risk so they can remain safely in the home? And ultimately what you see here in this visual is that at least as this process starts out, you're going to have a lot fewer available EBPs than you actually have children determined to be at risk. So that's why we do the concentric circles, with the goal ultimately being to expand that blue circle all the way to where C and B would be the same. Okay, so once states have conceptualized their candidacy groups, we then ask them to participate in a business process mapping exercise, and this is an example from Illinois. The reason why this becomes important is because we want them to really think about the different points in their system where potential candidates might interact with their system. It also gives them a sense of the volume that they might be needing to think about from a capacity standpoint later. How many will we have, and where will we meet them throughout our system? And these green circles show the candidate designation in Illinois. So once a state has gone through defining their candidates, who they are, how many, we're going to also ask states to think about, and they do think about, where are they located. And this becomes very important when you think about the alignment with services later. And this is one of the examples that Maryland put together to illustrate this. And you can see how their candidates are concentrated more heavily in certain counties throughout the state than others. This next example shows how Kentucky aligned their candidate pool with a particular need that can be met through Family First prevention and aligned with a eligible service. So they took who their candidates were, where they were, and then they attached to that those that had potential substance abuse needs, whether it's the child or the parent, and then they mapped this out as part of their building up of their candidacy piece of their prevention plan. This whole time, though, work groups are working in parallel. And so there's another work group that's working on the service array and really trying to understand what already exists within the state. So what this process comprises is essentially a scan of all the services throughout a state. And this can become very complicated for states. Some it's easier, some it's harder, but they can do it in a variety of ways. They can administer surveys to their known providers. They can interact with their sister agencies that provide services like mental health or the health department or a community service board providing substance abuse. But the whole idea is they want to get all this information so that they can make a good decision later about the readiness and the capacity of their services. Once all this information has been collected, the service array group will then pass this to a different work group who will then try to align it with the services that are on the clearinghouse, because there are different requirements that need to be in the plan depending on that evidence-based designation. So you can have well-supported services throughout the state, and you might be able to ask for a waiver and just talk about a CQI process. If you have a service that's very popular but it's not on the clearinghouse, they have to consider, are we going to get an outside independent systematic review and put it in our plan? If we have a lot of promising or supported services, do we need to consider partnering with somebody to do an evaluation, and then also the CQI strategy? This is an example of how Oregon did this process. They mapped out their providers, their EVPs, and then aligned them with the clearinghouse in a crosswalk. And so this inevitably leads to decision points, right? So they have their target population, their candidacies, they have their service assessment done, and what will happen at this stage is it will illuminate service gaps. So then the state will have to make some decisions about what to do next. And this is just an illustration of how Maryland did this. They mapped out 2 specific EVPs in their plan, the target ages of those EVPs, and then aligned it with all the jurisdictions that provided those services. This is nurse-family partnership and multi-systemic therapy. So this ultimately comes down then to decision points. Do we put new EVPs in our plan? Do we invest in current ones? Both. This is largely driven by fiscal realities that the state is facing and also just their organizational capacity for rigorous and ongoing evaluation and CQI. And to wrap up, there's implications they have to consider through all of this related to these 4 areas. So if you have any questions, go ahead and drop those in the chat, and I'm going to turn it over now to Letitia Young with Arkansas Department of Human Services. Thank you.
Hello. So I'm Letitia Young. I'm the in-home program manager for Children and Family Services in Arkansas, and I have been the lead for Family First implementation as far as the prevention services side of it goes, for the QRTP and that side of things that had to be worked out in order to be approved for Family First. That was taken. That lead was taken by another assistant director. So I would say if I had to have a theme for Family First in Arkansas, I would say that it is taking a leap of faith. We have had that attitude through the entire process. And Ms. Martin, our director, is nothing if not bold, and she's like, we're going to go for it. So we knew that, well, actually, I'm going to back up just a bit to say, a few years ago, Arkansas was in a foster care crisis. Our numbers were skyrocketing of children that were in foster care, and we had people come in, and not we, because I was not here yet, but central office leadership had partnered with our other sister divisions to really come up with how can we all work together to get Arkansas out of this situation we're in. So we had already done a lot of needs assessment, and we had put in Nurturing Families of Arkansas, which is just what we named it. It was actually the Nurturing Parenting Program as an evidence-based parenting program. We partnered with Medicaid to put Safe Care in place, and we had done a lot of work. So when it came to Family First, we had already kind of made some progress, but we had also already done, like, okay, what are we still missing? Where are gaps in services? And one of the things that we discovered is we currently have a program called IFS, Intensive Family Services. Home Builders is the most famous version of that. That is not what we have, but it's very similar, 4 to 6 weeks of really intensive services. And what we saw as a gap is that was appropriate for some of our families, but we were missing a whole other section of families that needed much longer support than traditional IFS could give. So we had gone and we had looked at other programs, found some that we liked, but then we put out an RFQ and said, and this is where the leap of faith comes in, because we were doing this like a year before, and said, we want you to come to us with what you think is an evidence-based program that will meet these needs that we see, and we're letting you know now that you have to make it onto the Title IV clearinghouse in order to continue your contract come October 1st, 2019. So we got some providers who were youth villages, presented us with Intercept. St. Francis came to us with family-centered treatment, and Youth Advocate Program came to us with Strengthening Families. And we had a few others, but those are the 3 that we chose. And again, we put this into place before we had even, writing a plan was even a possibility, knowing that we were going to have to get there. So once we really started planning for Family First, well, we had done the plan, but once we really started writing the plan, we kind of took the same approach that D.C. took and several of the other states that have already been approved or have submitted took, in that we knew what we as a state needed and where we were, and we were going to tell the feds, this is what we want, knowing that we didn't have a clearinghouse yet that had anything on the list, and we didn't know how that was going to be fixed in time for us to start on October. But like I said, leap of faith, we believed that it would work out, and it did. So to wrap this up with, or to connect it to the evaluation, we wrote our plan with the idea of this is our broad vision, and we talk about our substance abuse and our therapy and where we want to go with that. But we took a hard look at where we were as a state, and we knew that what we were in a good position for was our in-home parenting services. And so our substance abuse and our therapies are the long-term plan, but we knew that we did not have the capacity to do the level of evaluation needed on our substance abuse and our therapeutic modalities, where we did have that capacity to do those things on our in-home programs. And that was mainly due to budget, but also the way our contracts are set up. So all of that being said, once we wrote our plan and submitted it, and again, by the point we did it, the clearinghouse had come out with a few programs. None of them were programs that we were asking for reimbursement for. So we submitted, and then we got the direction from the Children's Bureau about how to go about doing an independent systematic review. So that is what we did. We took our 3 programs, Intercept, Strengthening Families, and Family-Centered Treatment, and we contracted with someone who we already had a contract with. We just expanded their contract to do an independent review of those 3 programs. And we decided finally on just 2 of them. So now we're doing Family-Centered Treatment and Intercept. So on the evaluation decision points, once we knew what was in our plan, and that we were going to have to do an evaluation, there was no way around it. I think we're the only state, I want to say that, but that might not be true anymore, that has written an evaluation plan in it. Everybody else was like, this is well supported and we're doing really strong CQI. And we knew we couldn't do that because none of ours were on the Title IV clearinghouse. So our evaluation decision points were who we could get to do the evaluation. We do not have our own evaluation team in-house, so we knew that we would have to go out, and we partnered with another state agency who was already doing a evaluation for our Safe Care program. They were already doing a process evaluation for them, and they were really excited about coming in and doing an evaluation for our other Family First programs. Then we had to decide which programs did we want evaluated. So we already knew that it had to be Family-Centered Treatment and it had to be Intercept because these are the ones that are in our plan that we are asking for reimbursement for. But we also had other programs in our wide range of prevention, and so we decided that we were going to take advantage of this situation and say, okay, since we do not have our own internal evaluation team and we have these other programs, we're going to get as much of them evaluated through this contract as we can. And I'll talk a little bit more about what we finally ended up deciding on in a minute. But so that was the decision point. Are we only doing our Family First approved services? Are we doing all of our prevention services? Are we only doing some of them? And what limitations do we have around that? So then our next really big decision point was, are we going to try and meet the clearinghouse standards or are we not? And I know that that might sound slightly strange, but this was at a Casey Family Conference a year ago, maybe a little bit more than a year ago at this point, when all the states were still trying to scramble and figure out if they were going to submit and when. And I do not remember who this was, otherwise I would give her credit for it. But I was in a small group and we were talking about the evaluation, and one of the people said, like, look, getting a program or a service to the point of enough research to show that it is evidence-based is a researcher's career. You can make your career doing that. And my responsibility as the lead on research in the state is, does this service work for my families? Is this helping my families? And those can be different questions. And so we really had to look at, okay, do we have the capacity to do what the clearinghouse is asking us to do? Or are we going to do still a rigorous evaluation, but knowing that it is not going to meet the standards to help the clearinghouse add more programs? And what we decided is that we were going to try. We are going to try to meet the clearinghouse standards, with knowing that we're not going to do a randomized control trial, that we did not feel that that was best for our clients. So instead, we are doing a quasi-experimental trial, and we are doing propensity score matching, and we are still trying to meet the level of rigor that is needed. And obviously, our evaluation plan did get approved, but we are hoping that it helps add to the clearinghouse. We know that it might not. So then the third is the interaction between CQI and evaluation. And so I will say this is when you're writing your plan, for the states that haven't done it yet. I think across the board we have found that the evaluation in the CQI process is the part that people kept getting more questions from the feds, like, no, we need more, no, we need more, no, we need more. And so on this piece, we had originally decided that CQI was going to be separate, or that we were going to do process and outcome all in one. And we were just going to use our regular CQI process for the plan. And we kept getting back from the feds, and they're like, no, we need more, we need more, we need more on your CQI. But we did not want to, I'm going to skip a slide. We did not want to have two different teams doing the same work. So we ended up just splitting out it completely. So our research team, our evaluation team is really going to be looking at, and I have this, I'm not going to go through it all, but they're the outcomes. Child safety, permanency, and well-being. Did this program keep kids out of care 6, 12, 18, 24 months after service? Did it prevent more true findings of child abuse? And then we did our CQI that we contracted with another provider who does our CQI as a state, to really look at those more process evaluation questions. And so I will wrap this up because I think I'm right at my time limit. What we ended up doing is our current programs for evaluation are family-centered treatment, Intercept. We are also doing Safe Care, even though we are not requesting payment for Safe Care at the time. We know we will in the future, but right now Medicaid is still paying for it. And then we switched our parenting program. After our independent systematic review, we decided that NFA was not going to meet standards, so we are taking another leap of faith, and we switched to Triple P, which is currently being reviewed by the clearinghouse. And so we went ahead and included that in our evaluation too. And then, so on our lessons learned, I would say one of the biggest things is, because of the timeline that we were on to do this, we really made some decisions about what went into our database separately from what we were doing with evaluation, because we did them at different times. And so now trying to figure that piece out and making sure that we do have the right information in our CRIS system is something that I wish we had been talking about a year ago. So I will now pass this on to Veronica.
Thanks, Letitia. Hello, my name is Veronica Burrows, and I'm the project manager for the Department of Job and Family Services with the Ohio Kinship and Adoption Navigator program. Our agency has supported several kinship initiatives over the past 20 years. One significant initiative was the Kinship Supports Intervention. This was a Kinship Navigator program that was independently evaluated, and it did show improved stability, assistance in reaching permanency more quickly, and it reduced subsequent maltreatment or reentry when the child was placed in relative foster care. This program was accepted on the California Evidence-Based Clearinghouse. It was submitted to the Title IV Clearinghouse, but it was ultimately not accepted. With the rise of children placed in out-of-home care and the passage of Family First Prevention Services Act, Ohio wanted to continue and to expand our work on kinship navigation services. Based on the lesson learned from previous projects, we knew that evaluation and data collection had to be a part of the program from the very beginning. So we've worked closely with Sarah Kay and her organization since we began developing this program. And so I'm going to turn it over to Sarah to share more about the Ohio CAN evaluation. Thanks, Sarah.
Thanks, Veronica. I appreciate it. And my name is Sarah Kay. I'm the principal investigator for the Ohio CAN evaluation and the principal for K implementation and evaluation. This partnership has been kind of a beautiful partnership between Veronica and her team at ODJFS. Connect is a nonprofit organization that does a lot of great work in Ohio. They're responsible for program administration of the Ohio CAN program. And then we take collaboration really seriously at Ohio CAN. And so there's a number of really impressive organizations that are doing a lot of great work to support Ohio CAN in its development and testing. And that extends seamlessly into our evaluation work. We at K Implementation and Evaluation take collaborative evaluation really seriously. And so we have had ongoing conversations and discussions about the clearinghouse requirements. We've got a lot of bringing multiple perspectives together to discuss feasibility, doing a lot of shared decision making, because there has been a very high level of interest and engagement in the evaluation. Like Letitia was describing in Arkansas, we are not working exclusively with an evidence-based program that's already been cleared by the clearinghouse. In fact, at last count, there were not any Kinship Navigator programs that had achieved the evidence standards for the clearinghouse. And so Ohio CAN is a new model that's under development now. And so the approach that we have taken to evaluation in Ohio CAN is one that is developmental in nature, because we have a program with Ohio CAN that's very early in its development. And so ultimately, we are eyes on the prize. We are striving for the clearinghouse, and ODJFS is committed that we are trying to achieve those rigorous standards that ultimately would like to demonstrate the positive and statistically significant effects. And so as we're thinking about all of the contributing factors to whether you are able to attain those effects, we are focusing on three different things. One is that we've got a really strong intervention that meets the needs of the service population, so the effects of the intervention itself. Another is consistent and high quality implementation across the state. And so keeping a close eye on fidelity and consistency and quality of implementation. And also we have high standards of rigorous evaluation methods that we are trying to achieve. And so Our developmental approach to evaluation with Ohio CAN is really staging evaluation activities so that we are supporting both the intervention development and refinement and its high quality and consistent implementation, as well as the ultimate effectiveness, test of effectiveness of the intervention itself through the evaluation. So I'm going to walk you through different 4 major decision points, focusing kind of within the context of the developmental evaluation, focusing on the effectiveness trial that's really designed to achieve those clearinghouse standards. The first is, who is the comparison group? From day one, the question about comparison group has been a really important one for Ohio CAN. The way that Ohio has conceptualized their adoption, kinship and adoption navigator program is that there are 3 broad service populations that include families that are more formally connected through child welfare interventions, families that are not connected to the child welfare agency but are kinship families, as well as adoptive families after the finalization of adoption. And so with these 3 broad service populations, the question of who is the comparison group is a really important and complicated one. So the way that we approached trying to answer that question is to work closely with our evaluation advisory team and do a little bit of orientation to the clearinghouse design standards. We, for the sake of inclusivity, and it's consistent with our values, believe that it's important that service providers, family members, policymakers, administrators, as well as researchers kind of have an opportunity to provide feedback into an evaluation design. And that requires a little bit of level setting and sharing of information so that we're all on have a basic understanding of what some of the important things are that we need to consider. And so with this advisory team, we kind of gave an orientation to the clearinghouse design standards and kind of carefully walked through multiple different potential comparison groups that included both experimental and quasi-experimental designs. We identified the strengths and limitations of each of the design options, and then ultimately adjusted the implementation plan so that it would allow for an experimental design. A next important question is, what are the proximal outcomes? And so the implementation team led by Chapin Hall facilitated a really stakeholder involved development process for a theory of change that linked problem statements with practices and practices with outcomes, and provided a complete picture of what Ohio CAN was designed to address and how it was going to address it and what those intended outcomes are as a result of those activities. The evaluation team then mapped the domains that were identified in the theory of change to the family first target outcomes, knowing that we had specific outcomes that we were hoping to achieve in order to meet the clearinghouse standards. We did a critical research review on outcomes of other kinship and adoption navigator programs, and then went through a process of prioritizing the most proximal outcomes to focus on where we thought that we would be most likely to see that positive, statistically significant outcomes. Another important question for us was, when should those outcomes be assessed? We know that we wanted to have a baseline at the start of services because that provides an important criteria for the clearinghouse, having a direct pretest and the option to do a rigorous examination of changes since baseline. And then it was kind of a balancing act to think about when we wanted to stage follow-up data collection late enough so that families would have the opportunity to experience the benefits of Ohio CAN, and early enough to minimize attrition, because we know that losing families or having them drop out from either the program and especially the evaluation for the clearinghouse guidelines is something that we really wanted to try to minimize to the degree possible. And then finally, how will we gather the data? We ended with shared responsibility between program staff and evaluation staff with the goal of minimizing burden and maximizing efficiency. So program staff are gathering information that's needed for case management. We've built a module that's kind of appended to the SACWA system to collect all of that administrative data, and families, when they enroll in OhioCan, are provided a disclosure that their information may be used for the purpose of evaluation. On the evaluation side, we are keeping a close eye on quality assurance for the program data, kind of providing feedback mechanisms about data entry and data quality. We also have research validated survey measures that aren't necessarily as relevant for the management and implementation of the program or case management for families, but they are important in terms of rigorous evaluation standards. And so we're able to link the program data with evaluation data through consistent identifiers. And for that kind of family survey data, we have a separate consent process that families can voluntarily choose to participate in. So just a quick overview of where we landed in terms of the implementation, evaluation, and the implementation plan and evaluation plan. Essentially, we have structured a staged statewide implementation. So from the implementation perspective, that it achieves the mandate to go statewide in October of 2020, and it also kind of acknowledges that staged implementation was needed in order both to manage resources and to facilitate high quality implementation. So staging of implementation served some implementation goals. It also provided kind of an opportunistic experiment. Knowing that we needed to do some staging of regions across the state, we decided to randomly assign that staging. And so we've organized the state into 2 cohorts. So the first cohort was randomly selected to implement Inform, Connect, and Collaborate first. All of the families and navigators in these blue regions then are assigned to the intervention group. Then cohort 2 is going to implement Inform and Connect first. And all of the families and navigators in the gray regions are randomly assigned to the control group. For context, Inform and Connect is essentially like information and referral. Inform, Connect, and Collaborate adds on the additional supports ongoing in terms of direct contacts with families. There's a specialized assessment. There might be more of a warm handoff and case management. And so it really is kind of an enhancement to information and referral in the Inform and Connect conditions. So in evaluation terms, this is a type 1 hybrid implementation effectiveness design that uses a randomized control trial. We know how important implementation is in ultimately achieving the kinds of outcomes that we want to see. And so we have a very close eye on implementation progress. We're using implementation data, both for CQI purposes to feedback for quality improvement, as well as understanding kind of when we're ready to launch the effectiveness trial. So once we feel like we're seeing a degree of consistency in implementation that we feel strong enough, we're hoping that might be around February of 2021, that's when we'll start enrolling families into the effectiveness trial. We know that with a cluster RCT, there are some additional things that we need to take into account in terms of analysis for outcomes. And so we're keeping a close eye on baseline equivalence of families that are enrolled into OhioCan and the intervention and control groups. We know that during analysis, we'll need to account for clustering of families within regions as we are kind of running our final statistical models. And so those are some additional considerations. But in terms of our evaluation design going in, it really has an eye on implementation and effectiveness and those informing one another. This is a high-level overview of the OhioCan theory of change. You'll see that it is a very ambitious program with a lot of activities and outcomes. The ones that are highlighted in yellow are the ones that map to the Family First outcomes that we'll be targeting. We absolutely are taking full advantage of the additional outcomes that are available to Kinship Navigator programs as we are focusing on developing our evidence, and we will be assessing those at baseline and then 3, 6, and 12 months. We anticipate that some of these outcomes we might see changes in sooner than others, and so we'll continue to keep an eye on all of those outcomes. We could literally talk about this evaluation design for days and days, but I'll stop here and turn it over back to Dory and to Chris to moderate our question and answer, but please feel free to reach out to any of us for questions about Ohio CAN or its evaluation.
Thank you so much, Sarah. I just wanted to thank everyone, all of the speakers, for such wonderful presentations. I found it very informative. Now we are going to ask our speakers some questions that folks have entered into the chat box, but please keep those questions coming. Let us know what you want to hear about from our speakers today. I also want to say, too, what's wonderful about this two-part session is that the information provided in Part 1 and Part 2 are so complementary. So please, if you were not able to see Part 1, look at those slides and remember that both Parts 1 and 2 are going to be available for you to go through at your leisure. So our first question that came into the chat box was for, I think, anyone could answer, so please feel free. Some interventions rated as well supported, such as motivational interviewing, could be considered an intervention technique that is used in the context of a larger program that has not been approved by the clearinghouse. For instance, a substance abuse program that has not been rated as promising or higher by the clearinghouse may utilize motivational interviewing as a component of that program. Are there any tips for how clearinghouse-approved interventions that are subcomponents of a larger program should be included in prevention plans, if at all? I'll open that up to the speakers.
So this is Letitia. I wish I had a better answer for you, but I think that is a question that all of the states have kind of grappled with, specifically on the motivational interviewing, because it is not something that is just its standalone thing. It's almost always in a subcomponent of something else. So I know that one of the things that we are going to be looking at in Arkansas, not yet, but at some point, hopefully soon, it would be looking at how do we use Family First to get our own staff trained in motivational interviewing and how to use it. As far as some of our substance abuse providers who obviously do it, and with our therapists who do it, we have not thought of a good way to write that into our plan yet. But if we figure it out, I will share it with others.
Great, thank you so much, Letitia. That was really helpful. Dory, would you like to ask the next question?
Sure. I would like to, we have one other question in the chat, so I'll bring that up from Maria Posey. And I think that this is for both Letitia and Sarah as well. How has or will racial equity and racial inequality factored into the implementation and evaluation design of both programs in Arkansas and Ohio? And that's for Veronica as well.
I can speak for Ohio and the Ohio CAN program. I think that from the very beginning, we have just tried to be really cognizant of equity and who's being included in regards to our stakeholders in the development of our program. We have reached out to multiple, since this is a statewide program, we have
a large variety of different ethnic populations. We're rural, we're urban. We have just a really large population in Ohio that we have to account and make sure that we are taking into consideration all the different types of people that we might be serving. So I think we've just been really conscious of who we're engaging in the development of this program, as well as we're going to try to put in some formal activities to make sure that we're maintaining this throughout our implementation and the maintenance of our program as well. So it is something that we are consciously thinking of. I can't tell you specifically everything that we're going to be doing within the development. I know obviously we will be having training for our workforce and things like that, but we really are hoping to do something a little bit more systemic with our program to make sure that we are taking in equity throughout our entire program.
And then on the evaluation side, our evaluation team is really committed to issues of culturally responsive evaluation and equitable evaluation. And so as we are kind of taking advantage of opportunities to develop and refine our measures, we're doing that with a culturally responsive and equitable lens. When it comes to analysis, we've got kind of a concurrent strategy going on. So for the clearinghouse requirements are very clearly, the randomized control trials, those give you average treatment effects for the entire population. And so it's important that we look at the population level effects. And so that's something that we are doing for the clearinghouse. In addition to that, we will also be having separate studies that are diving more specifically into issues of racial equity and cultural responsiveness that are more targeted, looking at potential differential impacts in terms of access and outcomes in the analysis that's sort of happening in addition to the average population level effects that we're doing for the clearinghouse. So I really appreciate the question, Maria, because it's something that's heavy on our minds as well as we're in our planning, and we'll pull it through to execution.
And this is Lisha, and I know that we're running out of time, so I don't want to take up too much to answer, but I wanted to add that we also really thought about it when we talked about deciding who our candidates were. And making sure that we were not pulling in people deeper into a system who shouldn't be and who could have more detrimental outcomes because we pulled them into our system further than they actually needed to be.
Well, thank you all for those wonderful answers. I know we might not have gotten to all of the questions, but feel free to send those along if you would like to get more information. Lauren or Meg, should I turn it over to you to have any wrap-up statements?
Well, I just want to thank, this is Lauren Untel from Administration for Children and Families. Just want to extend a huge thank you to all of our speakers today, our great moderators, as well as our sponsors, APHSA and PCG, and especially Meg Geiger. This conversation will be recorded and posted on the websites, and as Chris noted, please feel free to follow up with any of the presenters in the slides. Their contact information should be there if you have further questions. And thanks again, everyone. We hope to engage with you again in the future.